So for this cranial nerve examination, we're going to have Danny as our patient and Joe as the examiner. So the first cranial nerve we're going to test is going to be cranial nerve 1. And so to do that, the way we're going to do that is with the patient's eyes closed. Danny's going to close one of his nostrils, and Joe's going to give him something familiar to smell just to see if he can identify it.
Cinnamon.
Okay, now let's check the other thing. Maybe he'll switch it for something else.
Cinnamon.
Oh, he kept the same thing, and that's correct. Cinnamon's there. So what we're doing there is looking for symmetry. Unilateral loss can sometimes indicate a frontal lobe lesion, but cranial nerve 1, the olfactory nerve, was working just fine there. Cranial nerve 2, of course, is the optic nerve. There's a bunch of tests we can do: check visual acuity, check color vision, check confrontation visual fields, pupil, direct ophthalmoscopy. Today we're going to start with confrontation visual fields.
Okay, so I'm going to have you do is cover up your left eye with your hand. Very good. Look right here at my open eye. And use your side vision. Tell me how many fingers I'm holding up. 2. Good. What about you?
1.
Keep looking right here.
5.
And here.
2.
Good. You want to switch over to the other eye. Look now this open eye.
1. 2.
Good. Look here.
5. 2.
Very good.
Excellent, very good. And so then, like we said before, you can also check visual acuity, color vision, pupils, and do some fundoscopy, maybe with direct ophthalmoscopy. And that's to check cranial nerve 2. Now, obviously, if there's any deficits, we would investigate that further. We're going to move on to cranial nerve 3 now, the oculomotor nerve. And actually, for cranial nerves 3, 4, and 6, we know those innervate the extraocular muscles. And so what we're going to do is we're going to check extraocular motilities here. And Joe's going to go ahead and do that now.
Go ahead and look right here at the tip of this tuning fork. And let me know if there are any points as you follow with your eyes, if you feel pain or you see double.
Okay.
Very good. I'm noting full range of motion. And very the square on that side. And very good. Now we'll check for its convolutive reflex. And size pupils constrict ever so slightly as you converge.
Very good. And so there we know the cranial nerve 3, 4, and 6 appear to be working just fine. Other things we could do as well would be a Parks 3-step. If we notice any deficits or restrictions, that can help us to identify problems with innervation there. So we're going to move on to cranial nerve 5 now, which is the trigeminal nerve. And to test the motor portion, what we're going to do is ask the patient to clench his teeth. And then while he's doing so, Joe's going to palpate the masseter muscles to look for symmetry.
Good. Punch your teeth from Danny. And good. I feel them very equal inside.
Very good. Now we're also going to check all 3 branches of the sensory system by touching the skin with the tip of a cotton-tipped applicator to check for sensitivity, and we're going to compare the response to both sides here.
Okay, so go ahead and close your eyes.
Okay.
Good. You feel that?
Yes.
Good. Compared to how you feel down here, do you feel you need more or less?
No.
And down here on the jaw now?
No.
Very good. Switch to the left side. Check the frontal portion. Compare that to the field group, the maxillary portion. Feel the same?
Yes.
And mandibular portion of the facial.
The same.
Very good.
Perfect. All right. And then also, another thing that you could do, you can use the cotton wisp to check corneal sensitivity by pulling that cotton wisp out and lightly brushing it against the cornea, and the patient will indicate whether or not they can feel that. The next nerve we're going to check, so we've already checked nerves 4 and 6, which were the trochlear and abducens when we did extraocular motilities. We're going to move on to cranial nerve 7, which is the facial nerve. And so, with the patient's eyes closed, Joe's going to go ahead and attempt to force the eyelids open. So we'll do that first.
Okay, close your eyes. Try to keep them closed. I'm going to be pulling up on them. Very good. I feel equal strength from each eye.
Okay, very good. Next thing we're going to ask Danny to do is smile and then frown. Okay, so the muscles are working well. Very sad look. We're now going to ask Danny to puff his cheeks out, and the examiner will press on both cheeks looking for symmetry.
Very good. Try and resist me pushing them. Very good.
Excellent.
It was equal.
Yep, and that's again cranial nerve 7, the facial nerve. Cranial nerve 8, the acoustic nerve, or vestibular cochlear nerve. What we're going to do is have Danny close his eyes, and Joe is going to go ahead, and you can use we've read that you can rub fingers or you can just use a tuning fork. And I'm going to have Joe go ahead and strike the tuning fork while Danny's eyes are closed and place it on the vertex of the scalp. And this is known as the Weber test or the Weber test. And Danny, do you hear the sound equally on both sides?
Yes.
Okay, very good. Next thing, we're going to strike the tuning fork and we're going to hold it against the mastoid process until the patient cannot hear the sound. Then we're going to move it in front of the same ear. And compare the response. And we would expect that the sound to be louder in air than it is bone. Air conduction should be greater than bone conduction if everything's normal.
Yes.
Perfect. And we'll do that to the other side then to just go ahead and so we expect the same thing there.
Okay.
Very good. All right. Cranial nerve 9 is the glossopharyngeal nerve. So to do that, we're just going to listen to the sound of his voice, checking for any hoarseness. And we can also lump cranial nerve 10 into this, the vagus nerve, by using either a tongue depressor or a cotton tip applicator to check for gag reflex. Have the patient say ah, looking at the soft palate and the uvula, which should stay centered. If there is a cranial nerve deficit, the uvula will deviate toward the normal side. So we'll start, first of all. Danny's been talking a little bit, but go ahead and just say hello again. We'll check for any hoarseness.
Hello.
Beautiful. So I don't see any hoarseness there. And so what we're going to do is instead of using, we do not have a tongue depressor on us to check for a gag reflex. So instead we're going to have the patient say ah, and looking at the soft palate and uvula again, we're going to see if it deviates towards one side or the other.
I see no deviation.
Okay, good. Staying centered. That's great. So again, those are great tests for cranial nerve 9 and 10. Now to check the cranial nerve 11, the spinal accessory nerve, we're going to have Danny raise his shoulders, and Joe's going to go ahead and put some downward resistance there by placing the palm of the hand against the patient's, the top of the shoulders there.
Okay,
So raise your shoulders.
very good.
So resisting the pushing down.
Equal resistance on each side.
Excellent. Very good. Now what we're going to do is have Joe place the palm of his hand against the patient's face, providing resistance while instructing the patient to turn the head.
Turn your head to the right. Good.
Now to the other side.
Very good.
Excellent.
Equal on the side.
Equal resistance there. Excellent. And again, those are testing for cranial nerve 11, the spinal accessory nerve. And finally, cranial nerve 12, the hypoglossal nerve. We're going to have Danny stick out his tongue. A cranial nerve deficit would cause the tongue to deviate toward the weaker side. Let's go ahead and do that there. Very good, right at the camera. Excellent. Now, the last thing we'll do is Joe will place his hand on the patient's cheek while the patient presses against the cheek with the tongue. Maybe we won't do that one. Look for equal pressure on both sides. If unilateral weakness, it would be on the normal side.
It's equal.
Okay, very good. All right. And those are the 12 cranial nerves for the cranial nerve exam.